So as we said, sickle cell is the meaning the red cell is changed into a sickling shape. It is an inherited hemoglobin problem. So when you have got an alteration in the one of the amino acid in the beta chain in the hemoglobin, the production changes. And whenever there is less amount of oxygen, the sickle changes. That normally the red cell is nice and round shape. So it's nice and flexible to flow through the blood into a small blood vessels. But whenever there is less oxygen, with this medical problem in the sickling, the red cell will become into a sickle shape. So it becomes less, flexible, and it blocks the small blood vessels when it is flowing through. So when we say sickle cell disease, that means they are having a clinical problem where they are having a defective of two genes. Every person will inherit half of the genes from mother, half from the father. So when we have two faulty genes, you get a disease. If you've got only one faulty gene, then you become a carrier, but you don't suffer from the disease, but you have an ability to transfer it into your next generation. But it's only by 50% if you're a carrier. So just to give a little bit of clearance, if you're a person who is carrying the gene, that is, you're not diseased, if your partner, your husband is completely normal, you will not have a child with a sickle cell disease. That is, you will not have a child with a clinical problem. You may pass the gene as a carrier to 50% of them. So the disease meaning to say that you have got two faulty genes. If you've got one faulty gene, you're called a carrier or a trait. But if you've got two faulty genes, there is a sickle cell disease is a spectrum. You may have two faulty sickle genes. It is called sickle cell anemia, or you may have one faulty sickle gene, but the other half of the beta chain may have a thalassemia. Then you still have a sickle cell disease. So when you have a normal one with one sickle, you don't have a problem. You call it as a trait or a carrier. But half of the gene, you got it from your one parent is a thalassemia carrier and one is a sickle carrier. Both joined together, they form a major problem. This is called sickle beta thalassemia. It is also called a sickle cell disease. So when two genes have a problem, there is a clinical issue. That's what is the difference.